this is a really serious problem that we have to take seriously. I mean, people always say, well, the flu, the flu does this, the flu does that. The flu has a mortality of 0.1%. Sure. This has a mortality of 10 times that.
All right, estimates on the mortality rate for this new coronavirus have ranged anywhere from below 1% to 3.4%, slightly higher than the seasonal flu. And as the New York Times points out, quote, even a disease with a relatively low death rate, that's the mortality rate, can take a huge toll if enormous numbers of people catch it. Here with us, Dr. Amish Adalja. He's an expert in emergency medicine and infectious diseases. The doctor is also a senior scholar with the Center for Health Security at Johns Hopkins University, Bloomberg School of Public Health. Dr. Adalja, thank you for being with us. This is what people are trying to figure out. Even the mortality rate's obviously greater than the flu, but when we think about these rates, we don't really understand how we get to the numbers that we're getting in terms of the infection of this. This coronavirus, COVID-19, is more infectious than the flu.
Definitely. It definitely seems to be spreading in a pattern that's similar to the flu, but it may be more infectious than the flu. And it's going to attack more people than the flu because we have no population immunity to this. So with the flu, there are antibodies that people develop from the vaccine, from prior infections. But this is a novel coronavirus, and it will attack a large amount of the population. Maybe 50% or more will get sick with this because it's totally new.
You and I were talking in the break about viral load. Talk to me about this. There may be carriers have a lot of the virus, and that is what perhaps makes them so infectious?
Yeah, so when you think about how infectious you are to other people, one of the key factors is how much virus you shed. And what we're seeing with this coronavirus in some of the studies is that it has a much higher viral load in your nasal secretions, in your runny noses and your sneezes than, for example, SARS was. And SARS was something that was pretty easily containable once people figured it out. But this is behaving more like the common cold-causing coronaviruses, and that's why we're seeing this accelerated spread all over the world.
What, in your opinion, is the way to fight this? Obviously, we're getting word out there for people to wash their hands and try and, quarantine themselves, seek aid from doctors, use telehealth if they can. But what, from an infectious disease perspective, is the policy prescriptive to putting a halt to the spread of this?
The best thing is to identify those cases and then isolate those cases so they don't spread it to other people. This is similar to what happened in South Korea, where they actually have a low death rate, around 0.6%. That's the best way to do that. If you allow people to be out there mingling with this, you're going to spread it, and it's going to get into people that are high risk, and then you're going to have higher mortality rates. This is something that's going to be hard to contain. It's not containable through travel bans or airport screening or quarantines. This is something where we really have to find the cases, isolate them.
Right. And we have a strange travel ban coming into effect. It's for non-Americans traveling from Europe. I wouldn't have guessed that the virus would make the distinction all that well.
No, this virus will infect you no matter what country you come from, and we've seen that. There's dozens and dozens of countries now.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me, or click over on this list to see lots of other great videos.